Welcome back to Business Week here on Arise News. Now, Nigeria's pharmaceutical landscape is at a crossroads. Global giants like GSK, Sanofi and P&G have all halted manufacturing in Nigeria, stopped distribution or pulled out, citing a trifecta of foreign exchange volatility, importation bottlenecks and an unpredictable tax regime. In their wake, the country faces a huge health dilemma: soaring drug prices, a dwindling supply of critical medicines like vaccines and cancer treatments, and an increased reliance on imports. But while some multinationals are retreating, a new generation of Nigerian-owned pharmaceutical players is stepping up, determined to rewrite the industry's narrative. Companies like Sygen Pharmaceuticals and ORX Pharmaceuticals are not just filling the gaps, but pushing the boundaries of innovation. Their joint venture, Sygen ORX Biosciences, aims to boost local drug production, harness pharmacogenetics to improve drug efficacy for Africans, and drive research-led drug repurposing efforts. So, can Nigeria's pharmaceutical sector evolve from being import-dependent to an innovation hub? Can local companies scale up to provide drug security and reduce health risks for millions of Nigerians? Well, I'm glad to be joined in the studio today by two distinguished experts. First, Professor Alexander Macgregor is the chairman and CSO ORX Pharmaceuticals Core Canada and distinguished professor of biopharmaceutics and clinical pharmacology, as well as president of the Toronto Institute of Pharmaceutical Technology, bringing cutting-edge expertise in drug innovation and biotech. And also Charles Ogunwuyi, CEO of Sygen Pharmaceuticals, a key player in Nigeria's pharmaceutical space, is driving local drug manufacturing and life sciences advancement. He's a seasoned executive with over 25 years of experience across automotive, consumer goods, telco, and private equity. Welcome to the studio, gentlemen. I feel I'm in the company of the pharmaceutical creme de la creme of the industry. So great to have you here on the show. Thank you. I guess my first question to both of you, and I'd like to start with Professor, is really the news and narrative around the exit of pharmaceuticals from Nigeria, citing issues which I highlighted there. What gaps have really been left behind? Because there's a perceived narrative. Do we know what the real gaps are based on those exits?
Yes, thanks for having us. The actual gap that's left is the ability for Nigeria and Nigerians to access drugs. Now, when you're so dependent on multinationals who are highly, profit motivated, depend on them to provide all the drugs that you need in your country, what you end up having is that you're at the mercy of the big giants who look at the bottom line as the only factor that determines if they're going to stay in your country or not.
Right.
When the numbers don't add up, they exit.
They go, yes.
They may love your country, but the numbers don't add up, they exit. Unfortunately, Nigeria is at a crossroads. I actually think that the gap that's been created now would say necessity is the mother of invention. And we are at a crossroads where necessity would now drive us to come up with solutions. And that's a very, very interesting gap, and that leaves room for Nigerian-owned companies.
I was going to come to that
step
next.
in.
Absolutely. And so that's what I wanted to ask you, is I see this as a double-edged sword, an actual opportunity for Nigerian-owned companies to step up. Are they stepping up, and can they step up?
Oh, yes. Nigerian companies are stepping up. They have been stepping up, but I guess the macro situation has been quite challenging. But I think we're beginning to see certain shifts, albeit slow, but I think it's headed in the right direction. There's been a lot of push by NAFDAC over the years to try and kind of scale the Nigerian capability in terms of that industry. Now, you have certain things now being done by government. So the Minister of Health, as well as the President, has a special kind of task force called the PVAC team, led by a seasoned development finance person. So we're going to see certain things being put out there to put together a framework to help accelerate the growth of this sector. So, and we can step up. If those things come together, which I think they will with the way it's been structured, definitely we could see a boost in people stepping up.
And based on the research and statistics out there, we're still importing like 70% of our pharmaceutical needs. How does you're in a joint venture, Sygen, ORX, how are you going to help improve local capacity for drug manufacturing?
All right.
And whoever wants to, I guess both of you can take that. Yeah, Charles, maybe you can take and then Paul.
All right. So I think so. At Cygen, right, we are kind of focused primarily on two things: how we scale local production capacity, right? With the combination with ORX, it brings in another capability, which is also lacking here, which is the R&D capability, right?
Okay.
So together, we're targeted towards two key things. One, how we scale up local production capacity. And then secondly, how we start to look at repurposing drugs, right, existing generic drugs, to make them more efficacious for people of Black ancestry or African ancestry.
So when you say repurposing, for those people who are not in the industry, can you just break that down for us? When you're repurposing drugs, are you taking them apart and recomposing them? What exactly
so
are you doing?
I'm using very literal terms, but I'll let the scientists kind of go into more details, right?
Yeah.
So it's the purpose of making them more, how would I put it, more Afrocentric, because Africans have the widest genetic diversity.
Okay.
So what most people don't understand is when drugs become generic, right, it means it's out of patent, and for the most part, Africans are largely underrepresented in the clinical trial phase of most of these drugs, right? Because big pharma is highly incentivized by profit.
Of course.
Right.
Yeah.
So by the time the drugs end up coming down as generic drugs and we start to use them, African tends to have a higher adverse drug reaction.
Yeah.
It
Well,
may be,
not as
the
effective
efficacy varies.
Yeah. Okay.
Right. So.
Okay. So it's interesting because, Prof, when I hear that, and you can break down the science a bit for us, but one of the things that Nigerians are always concerned about, which NAFDAC has tried to deal with over many years, is counterfeit drugs. So is that something this joint venture is also going to be tackling, in addition to repurposing and all these other innovative moves?
Yes, essentially, counterfeiting is not something that is dependent on one factor alone, but it can be mitigated if you have, domestic R&D, where you're developing your own drugs.
That's research and development.
Research and development, and I have to be careful in the use of that term. There are many levels of research and development. There's rudimentary level, which is basic research, and there's levels of research and development, which is really development of existing drugs, that are repurposed for particular use. For instance, you can have an antiviral that's been repurposed as an anti-cancer, or you can have an antibiotics that are repurposed as an antiviral, because the targets are very similar. However, these drugs there's thousands of drugs, that are out there. Africans do not have the ability to determine which ones should work for them and which ones they should be using. So the term repurposing under the circumstances here is to identify which of those plethora of drugs are necessarily useful for Africans and which ones are better for us to actually embrace, because we don't have the luxury of a healthcare system that has money to pay for all kinds of drugs. Out of 100 drugs that comes to each Nigerian, you'll be very lucky if 20 of those drugs actually work.
That's interesting.
It's alarming. But that's because we did not invent, we did not innovate, we did not research those drugs. They were done in other countries.
Even the ones that come from the Far East.
Correct.
Right. Or South Asia.
Pharmacogenetics it's a critical factor. There's pharmacogenetics, there's also pharmacogenomics.
Okay.
Pharmacogenetics is simply how our body metabolizes the drug and determine what are the active principles that interact at the target site.
That's very interesting, because when I take drugs that, you never think, okay, this is made in India or wherever, but, you just take it because you trust the person who has prescribed it for you. But, there's one thing I don't want us to miss here. With all of the stuff you're saying about the sector regulation, research and innovation, you're also businessmen. And if you're investing in a sector and putting your hard-earned money in the sector, it's because you see viability, commercial and financial viability. So I want us to sort of talk a bit about the business side in terms of the industry, the growth of the industry, and the contribution of the industry to the economy. What are some of your pain points right now as entrepreneurs and investors in the pharmaceutical industry in Nigeria? And how are these being tackled? I don't know whether, Charles, you want to have
I think the pain point largely is access to financing.
Okay.
And that'll be access to financing that works, and long-term financing that works to help scale the industry. Because the entire goal of what we're trying to do as a nation, and I think that's what the government's trying to do, is create access to drugs and make them affordable, right? And it's getting really tough, right, to make affordable drugs, quality affordable drugs. So the challenge right now is really around that financing and the kind of structures that the financing will come through. And there's some interesting things being discussed that the government is trying to make happen. It's taking a bit of a while, but I think they probably may get there, sooner. But that is primarily the key thing for us here in the industry. How do we get, the right kind of financing that enables us to grow this industry and enables us to ensure that the products that we produce are affordable
and fit for purpose. So looking at the journey so far, now you're in a stage where you're in a joint venture because you recognize an opportunity that could actually make a difference. Is this joint venture, is this something that needs to be financed? Is this something that's being positioned for global investors? Or is this pretty much all a local push for partnership?
Well, it's actually both. I think that because its central focus is to enable Nigeria become the powerhouse in driving a paradigm shift in the way Africans access drugs. And this is a scientifically driven paradigm shift. It's not based on any guesswork. It's based on, what we call, there's anecdotal research and there's established research that actually shows that this does work in many countries. It worked in China. It worked in India. Countries that are a lot smarter, knowing what drugs work for their people, and they embrace that, as opposed to all drugs coming into their countries. That's why you have China and India producing drugs.
Yes, and I was going to ask you on that, they have such a strong manufacturing base, even just outside pharmaceuticals and drugs. What is it about the ecosystem in those markets? Let's take India, for instance, that positions them so nicely to become a global manufacturing hub for pharmaceuticals?
Well, it's just a mindset.
Okay.
I think India and China, they have the mindset that in every sector you have to enable what you would call center of excellence, human capital with the know-how. If you go to India, you find probably 1 out of every 5 person in any family would be a scientist.
Right.
You find them, go and do science, go and do medicine, go and do that. So that mindset already prepares them for this type of industry. And they realize it's a long-term play in industrial growth. We have to change the mindset in Nigeria as well, from that of traders to that of producers, manufacturers, researchers, to actually have that leverage that we're looking for.
Yeah, and Charles, if we're going to do that, I also like to always think about the human capital side. In terms of the enterprises that you've built, very formidable enterprises, what has been your experience in how you build a strong pharmaceutical sector? And I use pharmaceutical broadly because I know it's more complex than that.
Yeah.
From a human capital perspective, what are the skills and where, if you look at the entire value chain of human capital that's required to service this industry and from a manufacturing perspective, what does the private sector need to do and what does the government need to do?
So definitely needs to focus on expanding training programs, because we are churning out quite a number of pharmacists, right? And now are we churning out enough industrial pharmacists? So there's some kind of a...
so what's an industrial pharmacist and what's a pharmacist? Right. Help me understand.
So you tend to have pharmacists that are much more on what I'll call the
retail side?
Well, they tend to be on the retail side. Okay. They tend to be on the... they tend to work in hospitals and places like that, right? So they do understand pharmacy from a broad-based standpoint. And Prof is an expert in this, and he's done this extensively in Canada, right? Where, we have the same kind of primary educational system when it comes to going to university and coming out and being a pharmacist. But there's a kind of chasm between graduating as a pharmacist, right, and then being able to perform as a manufacturing pharmacist, which is what an industrial pharmacist is.
As opposed to someone who just buys their drugs from somewhere.
Yeah, exactly. So we need people like that. And part of why we also are doing what we're doing is also about this capacity building thing within that value chain. What Prof said earlier was about how do we spark Nigeria's being a super hub or super power for R&D innovation in Africa, right? When people start to see some of the kind of things that we want to do, they're low-hanging fruit things, right? That starts to kind of get people more interested, yeah, and build that capacity in the R&D space. And I think once that starts to happen, money will kind of follow that. Because look, in R&D, there is money to be made. And I think once people start to see that, the capacity pool will start to expand as well. But there's got to be some intentionality on the government side. Because if you look at India, they were very intentional, right? They had different components of how they wanted to build that pharmaceutical space. Capacity was one of them. Incentivizing pharmaceutical organizations was one of them. Some level of protectionism was also one of it. Okay. Yeah. So
tariffs?
You want to
announce that taxing imports?
No.
Is that
you will.
That will help.
If that will help.
That will help.
Yeah.
And I think many countries adopt those
tactics. Wouldn't that just make the drugs more expensive locally?
No, not really. It will shift focus from
to
the imported
base.
drugs to locally made drugs, and you have to be careful to make sure that you're not taxing across board.
Okay.
There are some very, very delicate drugs that you cannot tax because, to get to a stage where you can provide third-generation drugs, it takes a lot of time and effort to put into it. But rudimentary drugs that deal with the basic ailments Nigerians face.
Do we need to be importing paracetamol?
No. We don't need to be importing.
So things like that, I guess
like
that's
that.
what you
If we
mean.
put tariffs on paracetamol, I will be number one to vote for that. Say, all right, let's do that. Because we can produce that locally here.
Okay.
And, things like, pain relievers, anti-malarials, antibiotics, things that are rudimentary.
Okay.
Before we get to sophisticated drugs for, antihypertensive or congestive heart failure, those are pretty much, we call it sophisticated drugs. You can't make any mistakes on those drugs. It takes a lot of research to get it right. But we will get there.
Okay.
I think the point is to have a phased approach. If you stop people if you want to develop local manufacturing, you have to tax imports to discourage people from importing and to rely on local manufacturing. And then you have to incentivize local manufacturers. Many ways. Government can step in different ways. I mean, people need money to do research.
Of course.
Research is based on risk capital. And you have to mitigate in that risk, encourage people to put more money.
Indeed.
Government can come in many ways. Tax credits are being used in developed countries. Real cash, I'm not talking about balance sheet credits where you can't really see the money. You spend the money and you demonstrate you spend the money on R&D, the government will write you a check. And then you spend that money again and again and again, so it becomes
write you a check.
Write you a check.
So, a lot of what you're saying, it just seems to me that, this cannot just be a private sector drive alone.
No.
So, because we're almost running out of time, we've got about 4 minutes thereabout. Can you tell us what this joint venture, how it's going to change the face of the industry in Nigeria, and what your one message would be from a public sector perspective to support initiatives like this, seeking to really retain value from pharmaceuticals in the industry, contribute to manufacturing, and really help entrepreneurs in the space thrive? Maybe I'll start with you, Charles, very briefly, and then I'll end with
Sure.
I think I've touched on parts of it, but I think what this will do is definitely improve on the outcomes for people in the continent, right? In terms of drug outcomes and the efficacy of drugs and how drugs perform, right, in our systems. And it ultimately leads us to what we call drug security, right? How do we get to drug security? How do we reverse the ratio of 70% of the drugs in Nigeria and in the continent being imported, right? I mean, you've seen what happens when you have global supply chain disruptions, right? We just saw something a couple of days ago with what's it called? The USAID,
being
right?
pulled back. And
Being
they
pulled back.
supply antiretrovirals
Exactly,
and all that to
right? So we
donations.
need to get to that point where we're not just only manufacturing generics from other countries, right? That we're also now kind of doing personalized medications for our own people. Those things together, confluence together, kind of leads to strengthening our healthcare infrastructure.
Yeah,
So,
thank you very much. Prof, I want to end with you.
Yes.
Yeah.
So one of the key things that ORX Cygen collaboration is going to do it's going to provide the basic, the foundation for other parties in this industry to develop the courage to enter into the R&D space. Because Nigeria is a country where everyone wants to do what is tried and tested.
Right.
Nobody wants to be the first to do things. But if you are at the leading edge of any chart, and you know you're going to have the massive gain. We are coming from a wealth of experience. We know exactly how it's done. We know what do we need to do to remodel what we're doing to suit the environment that we're in. And that will help Nigerians to kind of get, and also collateral industries are going to develop.
Like which ones?
Well,
broader healthcare?
what we call the specialty pharmaceutical ingredients industry. Why do we need to import starch to make a product when we have cassava starch here?
Right.
Industries can develop where cassava starch can also be refined for pharma use. Things like sorbitol, things that we use as excipients. In a drug, you have the active principle. You also have the excipients. Those can be made locally, but they have to be made at a higher level of purity so that it can be useful as a drug as opposed to as a food. So that industry will blossom.
Yeah, I love what you said about the broader sort of multiply effect. I mean, this was like a masterclass in Pharmaceuticals 101.
Yes.
Thank you so much, Professor Alexander Macgregor, and of course, Mr. Charles Ogunwuyi, for talking to us about the Nigerian global pharmaceutical space. And we wish you very well with the joint venture and partnership.
Thank you.
Thank you so much.
Saigen and ORX.
Thank you.
Well, that's all we have time for in Business Week this week. If you want to continue the conversation online, let's do so on X. I'm Rolake Akikubefulani. Do have a lovely rest of the weekend, and I'll see you soon.